I'm Leslie Urdaneta. I'm with the National MPS Society, and I'm our Director of Family Support and Communications. I'm a social worker with the organization that really works to follow families and children diagnosed with MPS and ML kind of throughout the lifespan of the individual. The one thing that I wish I could tell providers with families and children who are going through decisions and topics about palliative care and end-of-life care are really just that, first of all, this is not a new topic for a family most of the time. I often start the conversations with the families saying from the very beginning, from somebody who's newly diagnosed, I already know what you've Googled and I know what's keeping you up at night. I know the first thing that you look up then is the life expectancy, and this is not a new topic. And I found that broaching it in that way means that you very quickly break the ice and allow for emotions to come out and discussion to flow from that people didn't expect to have someone confront so both gracefully and openly. These are topics that we tend to keep shrouded and keep totally under wraps, but when you have given a diagnosis to a family that their child has a terminal disease, this is at the forefront of their mind, and it sits there every single day and is a part of most of their conversations and in their decision making. So I think that offering something like the palliative care conversation can really and truly be a gift to a family, because you've allowed them the opportunity to express something that they've thought about already, but also give them a path forward for that thought and a roadmap to not a solution, but to some answers and to something that can actually provide comfort. The thing about palliative care in children is that really this is something that we can broach and provide at the time of diagnosis when they have a disease like one of the MPS conditions, because it's not life-ending in the same way that we often interpret hospice services. Palliative care is really geared towards expanding life and improving quality of life, bringing supports in place to minimize some of the medical impact and give more joy, more childhood, more experiences to these families and to these children. I do many different things in my role as a social worker, but one of the things that I like to do most that people tend to question me about or tend to avoid are having these difficult conversations, because as a provider with a family, you have a really unique opportunity to step into the hardest moments of their lives and be the ones to walk through that with them. When you walk through that with a family, that also means that you're not only a support for them, but you are the one who came to them at the time where they needed it absolutely the most and didn't shy away from those hard conversations. And so I can't tell anyone how many times I've had the discussion with a family about how much they just needed somebody to open the door to allow them a place to express what they've been thinking and feeling and considering anyway, and then to have someone who will really just be there faithfully through the rest of the journey. A lot of times my role in families who do then have children who enter a phase in end of life is just to be available, because they don't want to necessarily be the one making a call to slow feeds or to say that they're going to cancel some of these appointments or that they're going to stop needle sticks. They need some guidance to just say it's okay to make those choices. And anybody from the outside can do that and walk through that with them. And so that's one of the roles I think that providers can play in that palliative care space. And just overall knowing that opening that conversation does exactly that. It opens doors, it opens possibilities for discussions, it doesn't close anything.